I say I'm from Louisiana, but my early years were in India, where my summers were spent in my grandparents' village, a real village, monkeys and all. My grandfather was the village doctor. Baba and Amma's house is a square-shaped bungalow with a large central courtyard and his office at the front end. The other living spaces, kitchen on the left side, a prayer hall on the back side, and the dining space on the right completes the square. These all open into the courtyard. And this is where we all hung out. Oh, the open space above is enclosed by an iron railing because monkeys. The courtyard was also where Baba's patients hung out. They would just come on inside and visit with my grandmother while they waited. She was an active participant. For this reason, I always saw Baba's patients as just members of the community, guests in our home. The conversation that went on here could be about an upcoming festival, someone's house being robbed, who's getting married, the price of sugar or salt going up, what vegetable looked good in the market that morning, all affairs of town. They troubleshot for each other while waiting. Sometimes they left before even seeing Baba, for their problem had been solved. And to be sure, they were poor. They paid what they could, sometimes in potatoes, and other times unable to make eye contact, with the understanding that they didn't have anything to give. So we too often didn't have much. I had always regarded this all as normal, that this was how a doctor and their family lived and worked. And I fell in love with every bit of it. Not until much later did I see how rare and how foundational those summers were, wrapped up in that whole scene where there was no boundary between a patient-doctor space, caste, religion, and privilege. And now, oceans away and a lifetime later, as I look at the waiting room in my community center, it hits me that it looks a lot like my ancestral home. Here in the shadow of my late grandfather, and at a time when I worry so much is fundamentally wrong with the world, I find solace and purpose in advocating for my little patients and their families. Diagnosing their medical condition is often the easy part, but a pediatrician's world is prevention. And honestly, I'm often left feeling ashamed for what I ask my families to do. They cannot buy fresh fruits every day. I know they don't feel safe in the neighborhoods I tell them to take a walk in daily. I know parents work 2 to 3 jobs and can't read to their children daily. I know why their asthma flares up, why their BMI is not coming down, why they don't ask for help, and why traditional mental health care models don't work. I see their fear of law enforcement, and at day's end, I see why they can't sleep, why they feel despair. I am too often at a loss in my work, but losing hope is not an option either. When I got my Vote ER badge last year, I felt exhilarated by helping a teen register to vote, knowing this can impact their life, their family, and even their community far better than anything we clinicians can do within the walls of our clinic. We know communities that vote are healthier communities. This leaves us to reimagine our profession from what it has become to what it can be. Our medical training may give us the tools to recognize and treat illness, but there is no limit to how we can show up for our patients, especially when that which can alleviate their suffering is through civic engagement and policies that correct growing healthcare disparities, not our traditional prescriptions. With new eyes, I think what all can be accomplished in our waiting rooms, with us as trusted messengers, in this modern day courtyard. The empowerment that happens here, whether it's the COVID vaccine, an advanced care directive flyer, a smoking cessation or nutrition class, or voter registration information. These all serve the same purpose, seeing our patients for who they are, members of a community to which we share responsibility in its physical and civic health. August is Civic Health Month. As healthcare professionals, ours and our patients' voices can become a powerful tool in achieving the healthy communities that we all want. Join us at Vote ER and be a part of the movement.